Hey, how are you? My name's Anthony. I'll be your nurse for today. Could I get your first and last initial and your date of birth?
GA 8/24/2001.
Perfect. Performing hand hygiene and applying patient privacy. And with that, we're done our general checklist and we're ready to go on with the head to toe assessment. Right off the bat, do you know where you are today?
I do.
At the clinic, okay. And do you know what year it is?
2022.
Okay, so he's alert and oriented to time and place. Hygiene looks well kept. His posture is good overall. Healthy BMI, healthy looking individual. So right from there, we're gonna go right into our vital signs. So if I could just grab your wrist to see your pulse rate. Perfect. Pulse was 74 and respirations was 16. As I was doing that, I was checking his radial pulse, just checking beats per minute, and I was assessing his chest rise and fall to find his respirations. From here, we'll grab an O2 saturation with our pulse ox. Could I just see your finger for one moment? Put it on. He doesn't seem to be in any respiratory distress or anything like that, so should be 100%. Perfect. And from here, we'll grab his blood pressure. We'd ask him to remove this. He's okay right now. I do not have a cuff on hand, but if I did, apply the cuff about 2 inches above the antecubital area and make sure it's a snug fit. And also take the brachial artery. Are you in any pain today?
I'm not.
Okay, no pain. That's the sixth vital sign that everybody forgets about. And we'll check his temperature. I do not have a thermometer, but you can take this multiple ways. You can take it temporally. If you have a temporal thermometer, you can take it orally. If you have an oral thermometer, put it under the tongue. He has no fever today. He's all good. So with that'll complete our level of consciousness and overall well-being part of the checklist, and we'll move on to the head-to-toe assessment from here. We're going to start at his head. We're going to look at his hair, examine for any alopecia, any lesions of any sort, any infestations. That does not seem to be present. All is well, no lesions, no signs of any infestations. Scalp has no redness, there's no edema of the head. From there, we're gonna move right down to the head overall, eyes, ears, nose, that whole area. We're first gonna look at his skin of his face. No redness is present. We'll check the temperature. No edema is present, no swelling, no heat. And from here we can go right into the eyebrows. Hair is evenly spread. We'll go right to the eyes. Let me grab my pen light. Pen light. We're gonna check for perla, so pupils are equal, round, and reactive to light and accommodation. I'm going to shine this light. If you just want to stare at a fixed point, I'm just going to shine this light into both your eyes. Make sure your pupils are reactive. Pupils are round and reactive to light. And could you just follow this pen out and in with your eyes for me? This is checking for accommodation. Pupils are round and reactive to light and accommodation. Perfect. And from here, I'm going to use the pen light to check inside his ears. We're going to look for any abnormal discharge of any sorts. And that does not seem to be present. No discharge, good hygiene of the ears. From here, we're going to palpate the pinna. Does that cause any pain?
No.
No pain on palpation of the pinna. I'm going to check your nasal secretions now. Just want to tilt your head back. Check that the septum is midline. The septum is midline and nasal secretions are present. Good signs. Could you just give me a smile and then a frown? Smile is symmetrical. Facial expressions are symmetrical. He's able to change facial symmetrical, or he's able to change facial expressions, which is a good sign. Can you open up your mouth for me so I can check inside? From here, we're gonna look at the mucous membranes, hygiene, check for any signs of infection. No redness is present. Good hygiene. Mucous membranes are wet, so all is well. From here, we're gonna move right down to, actually we're gonna stay up top for a minute. Are you having any difficulty hearing?
I'm not. No.
Okay, alright, perfect. And are you having any new mouth sores or any tooth pain of any sorts?
No.
Okay, okay. And any facial pain or numbness?
No.
Okay, perfect, perfect. And how many times a day do you brush your teeth?
At least twice a day.
Okay, twice, perfect. Good health promotion. And from here, that assesses the head area. We're going to move down to the neck. We're going to start off by just inspecting the integumentary. Skin is free of rash, redness, swelling of any sorts. I'm going to start by palpating the carotid arteries and the upper 1/3 of the neck, one at a time. Perfect. And then I'm going to listen with the bell of my stethoscope to each carotid artery. Checking for bruits. No adventitious sounds are present, excuse me. From here, I'm gonna ask him to swallow. Could you swallow for me, please? Perfect. And we're also gonna palpate for lymph nodes, make sure they're not swollen at all. Okay. Lymph nodes are not swollen at all. Trachea seems midline. And could you move your neck? Could you look left and right for me? Perfect. Range of motion. Can you look up and down? Range of motion is perfect. And when I push down on your shoulders, could you shrug against? Perfect. No adventitious things stopping him from completing range of motion activities. And from there, I'm going to check your skin turgor on your clavicle. I'm just going to pull your shirt down just a little bit. I'm just going to pinch. And skin returns down to baseline immediately. No tenting is present, so he's well hydrated, which is also evidenced by his wet mucous membranes. And from here, I'm gonna assess your respiratory. I'm gonna do six spots on your anterior and 6 spots on your posterior. We're gonna do the vesicular, bronchiovesicular, and bronchial area. I'm gonna go, when I put my stethoscope on your chest, could you just give me a big deep breath in and out? Perfect. And we're gonna go to the opposite side to check for symmetry. No adventitious sounds are present so far. Okay, again. One more time. Perfect. And then we're going to move on to the posterior portion. If you could just turn for me, just so the camera could see. Deep breath in. And the same thing on the other side. Deep breath in and out. And again. Again, almost done. And again. And one more time. Okay, perfect. No adventitious sounds like wheezing, stridor, or any sort of adventitious breath sounds are present. Are you experiencing any shortness of breath recently?
I'm not.
Have you had any recent respiratory infections that you can recall?
No.
Okay, okay. And have you had any coughing fits of any sorts?
No.
Okay, perfect. And do you smoke?
I do not.
Okay, perfect. That's a good health promotion. A great way to prevent any respiratory problems. And from here, we're gonna move right on to the cardiac checklist. We already somewhat started with the carotid artery, but we're gonna listen to your 5 points of your heart. We're gonna start. I'm just gonna put the stethoscope on your chest at 5 different points. I'm gonna locate the aortic area. S1 and S2 is present. We're gonna go to your pulmonary area, or your pulmonic area. Excuse me. S1 and S2 is present. No adventitious sounds. We're gonna go to Erb's point. S1 and S2 is also present. We're gonna go tricuspid area. And last but not least, mitral area. Check the 5 areas of the heart. S1 and S2 is clear in each zone. We're gonna, from here, we are going to, we're gonna move right to the arms. We're gonna check brachial pulses. We're gonna do it simultaneously. After I find one, go to the other. Perfect. Pulses equal and bilateral +2. And we're going to move to the radial. If I could just see your wrist, please. Perfect. Radial pulses are equal and bilateral +2 as well. And I'm just going to look at the arms for a second to check for any edema, swelling, redness. That does not seem present. I'm going to check the arm for skin, for even hair distribution. That is present. We're going to check the nails for any clubbing, and also capillary refill. So I'm gonna press down and let go. It returns back to normal in under 2 seconds, which means it is within expected range. Same thing with this arm. Perfect. And from there, we're just gonna check out the range of motion of the arms. Could you just put them out forward for me? Perfect. And can you raise them up? And could you put them out to the sides? Perfect. And you can return them back. Perfect. Range of motion of the arms is perfect. Again, no edema present, anything like that. So we're gonna move right to the abdominal assessment. If you can just lean back a little bit for me, thank you very much. First thing we're gonna do in the abdominal assessment is inspect before we do anything. Check for distension, difference in coloration of the stomach, check the umbilicus, any unevenness, swelling, bruising. That does not seem to be present. So after you're done inspecting, the next thing you're going to want to do is auscultate. I'll start in the right lower quadrant and move counterclockwise. We're looking for bowel sounds. Bowel sounds are present in each quadrant. No blockages, it seems. After auscultating, you're going to want to palpate. We'll move in the same fashion. If there's any pain in the abdominal area, is there any pain in the abdominal area?
No.
If there's any pain, you're going to want to palpate that spot last, so they don't guard it as much. So we're gonna palpate, check for any hard lumps, anything that should not be there. Abdomen is soft. It's not firm, no cysts or any abnormal growths felt. And after that, after you palpate the abdomen, you can percuss to try to locate the spot of the pain. He's not in any pain today, but we're just going to demonstrate the skill. You're going to go counterclockwise and percuss your fingers on each quadrant of the abdomen, and this will help locate the pain. All right, perfect. He's not in any pain, so that did not hurt him at all. Just have a couple GI questions. Are you experiencing any heartburn as of recently?
No.
Okay, and any recent change in your bowel habits?
No.
Okay, perfect. And do you have any intolerance to foods?
No.
Say like lactose intolerance or anything like that?
No.
Okay, perfect. And from here, we're gonna continue to move down. One thing I'm gonna do though is if you could just stand up for me and walk towards the camera and back. We're just gonna be assessing for gait. Gait is steady and balanced. Perfect, thank you. And one more thing before you sit down. Can you stand like this? We're gonna perform Romberg's test. You could either hold your arms at your side or across, whichever is more comfortable for you. And you're just gonna stand like that for as long as you can, up to 30 seconds. Again, his gait is steady and balanced, so he has no issue doing this. All right, perfect. Thank you very much. You can take a seat. And from there, I'm just gonna assess the strength of your upper appendages. If you could just squeeze both fingers simultaneously. Thank you very much. Strength is good in both arms and hands is equal as well. And from there, we're gonna move right on down. We're gonna check the femoral pulse, the popliteal pulse, and we'll check the dorsalis pedis pulse. Dorsalis pedis pulse is present in +2. We'll also check for, we'll also be checking the legs for edema, swelling, anything that can point to cardiac issues, deep vein thrombosis, anything like that. Are you having any pain in your legs at all?
No.
Okay, perfect. And we're also looking for even hair distribution. That is present. Can you extend your legs fully for me? And push down your toes and pull them back up. All right, perfect. And can you just push back against my hands for your toes? Perfect. The legs have equal strength, and you can rest them for me. Thank you very much.
Yep.
No clubbing is present in the toes. Check capillary refill. It is under 2 seconds in each of his feet, which is expected. No edema is present again, and all pulses are equal and bilateral. So lastly, we're gonna I think that'll wrap up the assessment actually. Thank you very much for your time. From hand hygiene when walking out of the room, and thank the patient for the time.